Hi, my name is Ravi Vij. I'm from My Cancer Haven. And today, once again, in our Conversation with Cancer Experts series, we have Dr. Binod Dhakal with us. He's Associate Professor of Medicine, a well-respected and established authority in the field of multiple myeloma, been doing a lot of novel work, publications, and now he's going to talk to us about cemsidomide, which is data he presented at the recently concluded International Myeloma Society meeting in Canada, Toronto. So welcome, Binod.
Thank you, Ravi. Thank you for having me.
So we're going to talk about this phase 1 study of cemsidomide. And before we get into the data, could you lay the groundwork for our audience about what is cemsidomide?
Definitely. So the cemsidomide is what we call as degraders. They are the novel protein degraders, and if you look at it, it's a class of drugs like lenalidomide, pomalidomide, in that kind of a subject area, but it's a more potent degrader of transcription factor proteins that is very active in myeloma, the IKGF1 and 3. So I would say that this is a very novel mechanism, and there are a few other in clinical development. There is nothing has been approved yet, and when you compare to this novel, the protein degraders, I mean, this seems to be more potent when you compare to the other ones. They bind to the cereblon, as shown here in the diagram, and they cause the degradation of this IKGF1 and 3. And they have very high affinity to even myeloma cells with a low cereblon level. Sometimes you can have low cereblon, and these degraders may not be able to bind it, but in this case, this is able to bind that even with the low cereblon, and they can do the sustained degradation. I mean, we'll talk about the data a little bit later. We're looking at the IKGF1 and 3 from the peripheral blood of the patients, and we can see they cause sustained degradation of that. In addition to the degrading the protein and killing the myeloma cells, it also is an immunomodulatory drug in the sense that it activates the immune system, it activates the T cells, promotes the secretion of cytokines, and prevent the T cell exhaustion. And so that is something that helps in the anti-myeloma activity. One of the common class effect of these drugs is on-target neutropenia, because it disrupts this IKGF1, 3 and the hematopoietic stem cell system, and that helps us to understand how to dose this in the clinical setting.
So we have been hearing a little bit about another class